that's all the presentation. So if dear audience, if you have any questions, please let us know through the function of Q&A session. Before that, we would like to have a discussion among panelists, including Everest. So if you, dear panelists, if you have any questions or comment on the presentation, please do so. はい、じゃあ玉井さんどうぞ。I can't hear Tamai-san's voice.
Can you hear me?
Yes.
Okay, sorry. Thank you very much for a very interesting presentation. And I actually have two questions. And the first question is about the, how do you call it, the environment or resources to do research and development about traditional medicine in Cameroon to deal with COVID-19. For example, do you have any means to collaborate with government for your research budget and human resources? Or can you get any budget to develop medicines? Or do you also have any collaboration with global pharmaceutical companies? That is my first question. And the second question is about how, how do you call it, how COVID-19 can be understood or interpreted by local people under the context of the traditional medical systems, even though, as you said, there are more than 250 ethnic groups in Cameroon, which means that there are different cultural systems, traditional medical systems. For example, like when local people see the ill person without access to PCR test, who can diagnose as COVID-19 patients? Is it only by the traditional medical doctor or herbalist or like that? And how can they distinguish from other different or resemble symptom diseases? That's all. Thank you.
Right. Evarist-san, can you hear that?
Yes, I've understood very well.
Do you have any answers and short comment for the questions?
Okay, thank you very much. Concerning the first question about what kind of collaboration we have with government or global funds to conduct research on medicinal plants, what is true is that in Cameroon, there is a serious lack of funds, government funds, to support national research. There are sometimes some research projects developed by international partners, but usually such project is limited in time. So it is difficult to set up a long-term research plan based on these international funds. So at the level of the Cameroon, one of the very important difficulties is this lack of government support for research on medicinal plants. So there's a serious scarcity of funds to conduct research on the medicinal plants. Now, the second question about the traditional medicine practitioners, how do they diagnose, how do they distinguish between COVID-19 and other similar symptoms? Currently, the treatment applied by traditional medicine practitioners in Cameroon are symptom-based. So most of the traditional healers only treat the symptoms, and for the diagnosis, when I take the example, for example, of the Catholic Archbishop, who is currently one of the most prominent traditional healers fighting against COVID-19, all the patients he treats first go through medical testing in hospitals. So it is after the patient has a confirmed medical test showing that he's infected from COVID-19 that he can come now to the traditional healer to take the medicine. So traditional healers usually send patients first in hospital for diagnosis. It is after the medical confirmation of the diagnosis that they can now apply the herbal drug. This is one case. Another case is that most traditional healers, most of their treatment are symptom-based. So when a patient comes, the traditional healer gave herbal drugs only based on the symptoms that the patient is showing.
Okay, thank you very much, Evarist. Yes, we understand very well. What about other panelists? Do you have any questions, comment?
じゃあ、
はい、平野さん、お願いします。
はい、my name is Mr. Hirano from Kyoto University. So, thank you for your informative presentation. I'm impressed. I'm impressed by that Cameroonian people are not only waiting for vaccine development of other countries, but they are trying to confront COVID-19 by using indigenous medicine. And I heard that in China, also the Chinese government has been introducing Chinese herb and Chinese medicine doctors for the prevention and the treatment of COVID-19 from an early stage. But in the case of Cameroon, unlike China, not the government, but the people themselves have the initiative to use the traditional treatment as measures for COVID-19. So I think this is really interesting. Okay, I would like to ask you two questions. Yes. Okay, first question is sometimes occur in Japan, but if certain ingredients or medical plants is good for COVID-19, will there be a buyout or rise in prices? For example, lemon is good. The price of lemon augment. So in other words, does this traditional treatment or traditional traditional herbs cause economic or social problems in market in Cameroon? If you have some, maybe it is, okay. And second question is, okay, personally, I'm interested in the National Solidarity Fund on slide 8 in your presentation. And does this mean that the wealthy people in Cameroon donate for COVID-19? So who donate this fund and what's happening? So just government corruption, you explain a little bit, but you have more information. Can you explain more about this fund? Okay, thank you very much.
Okay, thank you very much for these two questions. Concerning the first question, yes, there has been an economic impact of the COVID-19 on the prices of medicinal plants. For example, if you take the case of lemon, because since the outbreak of COVID-19, lemon was very sought in market by the population, and the prices almost doubled in the market. So a few fruits of lemon that previously you may buy at €1 might become €2 or €3. So there has been an economic impact of some of the plants that were strongly sought by the population for the management of COVID-19 pandemics. So now, concerning the National Solidarity Fund, this National Solidarity Fund was launched by the President. And the first contribution to this Solidarity Fund was done by the head of state, His Excellency Paul Biya, who put in significant amount of donation. Then now, individual Cameroonians also started contributing to the fund ministers, government officials, business operators. So the fund receives significant contribution from almost all layers of the population. Government official, private sector, civil society organization, they gave significant donation. Some of the donation was in cash, some of was in terms of medical equipment or supplies. So this is how the fund managed. And now there was a management structure that was put in place to manage the fund at the level of the Ministry of Public Health. So after a few months of using this solidarity fund, as I said, there has been a series of critics from civil society organizations accusing the management structure for corruption and embezzlement because the amount of money or what that was contributed to the solidarity fund, the population was not seeing that it is the investment done in the field was matching the amount of money that was collected. This is why critics have been rising over the use of this National Solidarity Fund. And as a consequence, the government ordered investigation into the management of this fund.
Okay, thank you very much.
Thank you very much.
We have a question from one of, just Sakai-san, please. After that.
Yeah, thank you very much for your presentation. And well, actually, I'm specialized on the politics and the society in the Middle East, and I'm quite unaware about the situation in African countries. But studying on the COVID-19's influence to the Middle Eastern society, actually it has a very big impact on the way of life among the Muslims. And well, your main argument is about the traditional medicine in Cameroon, but just I wanted to shift the viewpoint to the impact of the COVID-19 to the social life in among the population in the Cameroon. I think that I think 2 or 3. 20 or 30% of the population there are Muslim, right? I believe. So how does the COVID-19 affect the way of life of these ordinary people in Cameroon, especially in the religious life, religious or the communal life? This is my question.
Okay, thank you very much for this question. In fact, the COVID-19, there has been significant impact on social life in the country. Not only in the religious aspect, but in many other aspects of life. For example, because of measures of confinement that was set at the beginning of the pandemic in Cameroon, most of the households were obliged to stay at home. And during this period, the number of unwanted pregnancies have significantly risen in the country. So this was a social impact that was reported by newspapers because most of the students who were no more going to school were being engaged in devious practices. So this is one aspect. Another aspect in the social life is that the Cameroonian has a lot of difficulty to adapt to COVID-19. For example, among the hygiene measures, it was prohibited to greet some others by shaking hands. And Cameroonians are very used to shaking hands. Every time they meet, they need to shake hands. So it was very difficult to adapt to this new situation. Then at the level of the religion, during the confinement period, all the churches were closed. There was no more church celebration. So the population also need to adapt to this situation. Most of the households were following churches now through a video conference or through TV broadcasting corporations. There was no more possibility to go to church. And this is another aspect in the religion. Another aspect was in the, as I said in my presentation, in the management of person who died from COVID-19. There have been several situations reported in newspapers, for example, where families came to go to the street fighting with forces of order because their family member is said to have died from COVID-19, and the forces of order need to bury immediately. And the families are used to keeping their corpse to organize adequate funeral services for their dead ones. So this have also created culturally shocked. This is why many population were avoiding going in hospitals, because each time they go to hospital when somebody died, they are afraid that he will be suspected of dying from COVID-19, and the government will take immediately the corpse to go and bury. So this has been also a very cultural shock that was difficult to withstand for the population. So another impact was still in the prices. At the beginning, for example, the hand sanitizers. One bottle of hand sanitizer that was previously, for example, costing €1 was sold at almost €5. And as a consequence now, many laboratories, many chemists in Cameroon started producing hand sanitizers. This was also the case for face mask, that at the beginning was extremely expensive, until now the private sector started engaging in the production of face masks so that the prices get reduced. So these are, among others, how the COVID-19 has impacted the social life of the population. Not forgetting also the issues of social distancing. So when you go to any public services, you have to wait for a long time because there's no overcrowding is not accepted in any public services. So people have to adapt to this new situation.
Okay, thank you very much.
Thank you very much. Thanks a lot.
Evarist-san, I have three questions from the audience. So I want to read three of them. First question from audience is, well, I can translate properly or not. In Japan, we have a saying like this: disease start in mind. Or in other words, your mind control your body. So if you believe in something, if you believe in traditional medicine, you will be cured with traditional medicine. But if you doubt it, you will not be cured. The question is from the audience is that the people of Cameroon really believe in traditional medicine or they doubt it? It's a general question. They really believe in traditional medicine or they doubt it? That's the first question. Second question is thank you for the presentation. I have two questions. The first one is, other than the Archbishop, Catholic Archbishop, for traditional medicine in your presentation, what kind of traditional healers are collaborating with scientific researchers regarding COVID-19? Is there any tendency based on religion, ethnic group, gender, or the area? How do researchers, botanists, or conventional medical doctors differentiate prominent or good traditional healers and from bad in order to proceed scientific, quote unquote, research project? And that's the second question. And the third question is, from slide 22, why Cameroonians' local private pharmaceutical industries, drug industries, don't show their interest in herbal drug development? That is the third question. I'm glad if you answer questions.
Okay, thank you very much for these three questions. Concerning the first question, it is really true, even in Cameroon, both disease and treatment start first in mind. When you don't believe in something, it might probably not provide the effect you expect from it. The situation in Cameroon is that in Cameroon, we can say there are two types of traditional medicine practitioners. There is a category of traditional medicine practitioners to whom the population has a level of trust. There are also fake traditional healers who can publicize fake research just to earn some money. So this is real in Cameroon. So it is really a challenge for the population how to differentiate between these fake traditional healers and the real traditional healers. So far, at the level of the Ministry of Public Health, there is a National Association of Traditional Healers that was put in place. And that association at the national level and local level has a representative. This was a way to bring traditional healers to identify themselves who are the best traditional healers and to discard the fake traditional healers. So most of the real traditional healers are organized into associations and they are recognized by their association as a traditional healers. Notwithstanding this, Cameroonians strongly believe on the efficacy of traditional medicine. So it is not only in this situation of COVID pandemic that the population is showing a deep attachment to traditional medicine. Previously, most of the Cameroonians prefer traditional medicine instead of modern or chemical medicines. So the Cameroonians strongly believe, but Cameroonians at the same time, they have a worried about the fake traditional healers who sometimes are also present in the society. Now, what type of traditional healers collaborate with scientists in Cameroon? One of the difficulties, as I mentioned in my presentation, is that the collaboration between traditional healers and scientists is very poor or very weak in Cameroon. And there are a certain number of reasons for that. First reason is that so far, traditional healers have accused the scientists of stealing their knowledge and developing their knowledge to make money without them getting the benefit from their knowledge. This has created a situation of very weak collaboration between scientists and traditional healers, who are also always afraid that the scientists will come and take their knowledge, go and develop, and they will not have anything in return. This is a situation that is critical in the country. And whereas this collaboration between traditional healer and scientists is very, very important for the development of herbal drugs. So far, what the government has done to address this issue was that, for example, within the framework of the Cameroon Ethnobotany Network, there are a number of traditional healers that have been collaborating with scientists based on the common agreed terms of the collaboration. Also, at the level of policies, the government of Cameroon since 2014 has ratified the Nagoya Protocol on Access and Benefit Sharing. This Nagoya Protocol on Access and Benefit Sharing set in place a framework to protect the indigenous knowledge of local community, and also to ensure that the knowledge and resource of the traditional medicine practitioners are adequately used and that they get significant return from the development of their knowledge. So this is a situation that is still critical in the country, and there are ongoing efforts to establish a good collaboration framework between traditional healers and scientists. Now, the other question is why the local pharmaceutical industries are not showing interest in herbal drug development. I think probably one of the main difficulties is this difficulty of establishing a relation of trust between the business companies and the holders of traditional knowledge. Because if they don't establish this relation of trust with the population, they will not have the knowledge and the resource. And most of the business countries, they are capitalists. They care much about the benefit of the company, and it is likely that they might not take into account the interest and the willing of the holders of the traditional knowledge. But since the Cameroon ratified this Nagoya Protocol on Access and Benefit Sharing, progressively there is a framework that is being established to encourage the local pharmaceutical companies in Cameroon to invest in herbal drug development. And the ministry is arranging to establish a good collaboration framework that protects the rights of the traditional healers and also promotes the activities of the business operators.
Okay, thank you very much. And one message came from the audience. This is not a question, this is just a comment. Thank you very much for informing us that there are two different types of traditional healers, those who people believe in and those who people do not trust. And in the case of Japanese traditional healers, Ceramem shows the same thing. That's the question. That's the comment from the audience. Is there any comment or questions from panelists or even from audience too? Hi, Ishito-san, dozo.
So thank you very much for your very insightful presentation. I learned quite a lot, although I'm not a specialist on the African continent issue. I'm really interested in the commitment of the African Union. For example, I checked the internet, then there is this, AU, African Union-wide Africa Joint Continental Strategy for COVID-19 Outbreak, which was released in March 2020. So do you think African Union's commitment to this COVID-19 is effective enough or, recognized enough? So that's my question. Thank you very
much. Thank you very much for this question. Effectively, after the first cases of COVID-19 started being reported in Africa, the African Union took position and set a continental strategy for the fight against COVID-19. But what is true is that the African Union always suggests directives, and it is the responsibility of individual country to implement locally. So the African Union gave the overall strategy for Africa. Now at the level of the country, it is each country, for example, at the level of in Cameroon, it is the Ministry of Public Health who is in charge now of implementing this continental strategy at the level of Cameroon. But one main difficulties in implementing this strategy is also the lack of funds, because it is good to set strategies, to set orientations, but for the implementation, we will need resources. And the African Union, up to now, strongly based on European Union for his fund. So this is one of the difficulties African Union has in pushing forward the implementation of COVID-19 response strategies. So African Union just set directives, and now it is each individual country who look for resources to implement at the local level.
Thank you very much.
Thank you very much. Is there any questions or comment from panelists as well as the audience? It's almost time to end, but if you have any questions and comment, if there are no questions and comment, before we close this webinar, let me ask Evarist very, very simple questions. I have two questions, but they are very simple. The first question is, in the slide 5 of your presentation, you told us that as of 23rd August, COVID-19 cases is 18,000, but the number of deaths is just 408. And to me, it sounds very small. I mean, the death number is quite small if we consider the situation of medical services in Cameroon. If you have any questions or ideas why the number of deaths are so small, and that's my first question. And my second question is, what attracted me most in your presentation is Elixir COVID or Adosac COVID provided by the Catholic Archbishop to treat the COVID-19 cases. What about other missionaries like Nigerian Pentecostals, evangelical missionaries or preachers? Are they also active in the treatment of COVID-19 in Cameroon, or they are not? That's my second question.
Okay, thank you very much. First, concerning the number of deaths. Currently, the cumulative number of deaths is about 400 in Cameroon. And this number is really surprising many people. How, with a total of more than 80,000 cases, only 400 deaths. So there are many hypotheses that can be used to explain this. So first is that there is the traditional medicine sector has brought significant contribution in the fight against the COVID-19 in Cameroon. Since the outbreak, many of the population started using the herbal drug, not only for the treatment, but even for prevention. So probably this can be one of the reasons. Another reason is that in the local diet of the population in Cameroon, almost everything the population eats has a strong medicinal value. When we take, for example, the common turmeric, where there are studies reporting the inhibitory effect of this plant on the 2019 novel coronavirus. This is a common spice that is very consumed in Cameroon. So probably in the local diet of the population, there are many of the foods that people eat that has a medicinal value that help the population prevent or protect them from COVID-19. Also, there have been scientific hypotheses that in Africa, for example, there is one vaccination program that is done almost in all countries in Africa, especially in Cameroon. And there are scientific literature that was showing positive correlation between this vaccination and the protection of the population against COVID-19. This was a scientific paper that was published and showing that most of the countries who undergone massive vaccination of this vaccine are showing a kind of they are showing more resistance to the infection of COVID-19. So there are many hypotheses that can be used to explain this. Now, for the LXC COVID and ATSA COVID, what about the other missionaries? Okay, this LXC COVID and ATSA COVID was developed by the Catholic Archbishop of Douala in Cameroon. But the knowledge on traditional medicine is not really associated with the religious belief. So in Cameroon, traditional knowledge is transmitted from generation to generation. So if in your family you had a family member who was a traditional healer, he will transmit to you orally the knowledge, independent of whether you are Muslim or Catholic or Protestant. So this is the situation. Of course, there are many Muslims that are also traditional healers and that have also suggested some treatments for COVID-19. But this is a community or family knowledge that is transmitted from father to the child and is perpetuated from generation to generation.
Okay, all right. Thank you very much for your answers. Is there any comment or questions anymore? Okay, as there is one question came from the audience. May I ask what kind of vaccine that you mentioned just now? You just mentioned, vaccination was done throughout the Cameroon. What kind of vaccination is that? That's a question from audience.
The vaccine is called here BCG.
Ah, BCG.
Yes.
Oh yeah, we know. Ah, okay. Okay. BCG. Thank you very much. Is there any questions or comment? Is it okay? All right. I think it's almost time to end. So I want to close this webinar. Thank you very much. Evaris, thank you very much for your informative and stimulating presentations and accurate answering questions from Japanese audience. Thank you very much for joining us.
Thank you
very much.
Thank you very much. We are going to close. Thank you.
Thank you very much.
This is the end of the webinar. Thank you
very much.